Fish Creek.
Hey.
Thank you, Mr. Speaker. Mr. Speaker, today is a very sad day. The cancer lab at the Tom Baker Cancer Centre closes its doors.
Jeez.
After more than a decade and after serving more than 10,000 patients using research and testing developed exclusively in-house, the lab closes despite dire warnings from Dr. Tony Malioco. He did everything he could to stop it. Not only was he ignored, he was threatened and he was smeared for daring to speak out. My questions are to the Premier. We know that you dismiss this critical issue as a workplace disagreement. Is that how you're going to treat the countless examples of bullying and intimidation of healthcare professionals?
Good question.
The Honourable Minister.
Oh,
Thank you very much, Mr. Speaker.
Answer?
Well, this issue was discussed in question period previously. The questions were asked and answered. I guess what I'd like to say, Mr. Speaker, is that this recurrent theme of innuendo and rumour with allegations of physician intimidation has become quite tiresome to this government, and in fact, in our opinion, is an insult to the dignity of this House and to the people that work on our healthcare system.
The Honourable Member.
Mr. Speaker, that is unacceptable. He's already got his own Health Quality Council investigating intimidation, and as the Minister, he has the right to stand up and say it isn't happening. What are they doing now?
The Honourable Minister.
I'd be very happy to tell you what's unacceptable in my view. What is unacceptable in my view is when I have briefings with my staff, as I did earlier today, and I discover that my staff have been accused of intimidation and collaboration with respect to bullying physicians of this province on the basis of no information, no fact. My staff are simply out there doing their job, conducting a regular billing review, and they are accused, Mr. Speaker, of physician intimidation. And that, Mr. Speaker, is clearly unacceptable.
The Honourable Member.
Mr. Speaker, Albertans are not going to accept what he's saying, and the healthcare professionals in this province are not going to accept what he is saying. Given how Dr. Malioco was shamefully treated simply for advocating on behalf of his patients, and given that he has stated he would return to Alberta to testify at a judicial inquiry, will you commit immediately to having a judge-led public inquiry as you promised?
To the Premier. To the Premier.
She doesn't want to answer it. She's
Acceptable
afraid.
is what passes for a definition of intimidation in this House by the honourable members opposite. Disagreement among people in the workplace does not constitute intimidation. Staff of my ministry conducting a regular billing review under the auspices of the Alberta Healthcare Insurance Act and being threatened with court action as a result of undertaking their responsibilities under law is not intimidation. What is intimidation, Mr. Speaker, is these continual allegations based on rumours, innuendo, nothing.
The Honourable Member for Edmonton.